Welcome to Global Ethics Review. I'm Alex Woodson from Carnegie Council, the world's catalyst for ethical action. In this podcast series, we'll be connecting Carnegie Council's work and current events with our senior fellows, senior staff, and friends of our organization. You'll hear from leading experts on artificial intelligence and technology, migration, public health, and U.S. foreign policy and global engagement. This week's podcast is the first in a series on the COVID-19 pandemic and the ethics of global vaccine distribution. As we enter the summer of 2021, some nations, like the United States or the United Kingdom, are seeing vaccination rates of around 50%, effectively ending the imminent threat of mass hospitalization or death due to COVID-19. Other nations, including many in Latin America at the time of this recording, have vaccination rates around 10% or lower and are still facing public health emergencies. These states simply do not have the same access to vaccine doses. In recent weeks, the Biden administration has put in motion a plan to help distribute tens of millions of doses to some of the neediest nations. Though many have applauded the move, there is less consensus as to whether it goes far enough. Given the global inequities, what are the responsibilities of vaccine-rich countries to the rest of the world? What ethical considerations should guide policymakers' thinking on these issues? To start to answer some of these questions, and to understand the ethical underpinnings of some of the policy choices we're seeing play out, I spoke with Dr. Cécile Fabre. She's a senior research fellow at All Souls College, Oxford, and professor of political philosophy at the University of Oxford. For more on the COVID-19 pandemic, the vaccine, and ethics, you can go to carnegiecouncil.org. I'll be back in the coming weeks with much more on this topic, but for now, here's my talk with Professor Cécile Fabre. Professor Cécile Fabre, thank you so much for speaking today. I'm looking forward to this.
Thank you for having me.
Of course. So the first question, I want to ask a question or two just to make sure we're all on the same page with our audience, with some terms and some of these ideas. So just to get started, as a philosopher, what do you see as the major moral considerations when you think about ethical global vaccine distribution? What are some of the issues that come up for you?
So one of the main issues, if not the main issue, is whether or not national and political borders are morally relevant. So whether the fact that a person is born on one side or other, of a border, or is a citizen of this state rather than that state, makes a difference, morally speaking, to whether or not that person should have access to the vaccine, which is a life-saving resource. So some people frame this as a debate between vaccine cosmopolitanism on the one hand versus vaccine nationalism on the other hand. I don't really like the term nationalism in this context. It has very negative connotations, so I prefer to speak of, priority for residence. And so to illustrate, the issue, I'm French, as you will have gathered, from my accent. I live in Britain. I'm a long-term resident, of the United Kingdom. So the question really is this, does the fact that I'm a long-term resident in the United Kingdom mean that the British authorities should give me priority when it comes to access to vaccine, or are they morally required to send vaccine doses abroad, to help people from other countries? So the radical cosmopolitan will say that borders are completely irrelevant, morally speaking. So the fact that I'm a long-term resident of the United Kingdom, on that view, does not give me greater priority over vaccines, which are within the control of the British, than if I were born and lived in a completely different country. The radical nationalist will say that the government of the United Kingdom is morally obliged to give me absolute priority over someone who resides in a different country. It's not just that they are permitted to give me priority, they are morally required to do so. And so the first answer to your question really is, are borders in that sense morally relevant? And in between, those two extremes, there is a range of views, obviously.
So yeah, I'd like to get into some of those views, and maybe a way to get there is, you said that you don't like the term nationalism.
That's right.
Context. So Maybe we can start there and talk about some of these views. So why don't you like the term nationalism in this context? Maybe what's a better term that we can think of?
So the term nationalism has a very dark, history, and the darkest, most negatively connoted way of framing, the radical nationalist position, consists in saying that, residents of a given country, or in fact, even worse, people who share, the same ethnic origin and who live, in the same country, have ties that bind them, which justifies, indeed mandates, giving one another priority over people who are not members, of this particular group. But I think there is a better, more plausible radical nationalist position, which makes no reference at all, to the often or sometimes mooted racist, connotations of nationalism, which is, well, no, it's the relationship of residency. So by dint of living together, under the authority of the same state, other British or residents of Britain and I, have something in common that obliges us to give priority to one another over, for example, someone from Kenya who lives, in Kenya.
So one of the ideas to deal with this issue is the fair priority for residence framework. So I was hoping you could explain that.
So in a nutshell, this particular framework, so the FPR framework, says the following: that governments are morally allowed to retain vaccine doses which they are able to procure for their residents up until the point at which they are no longer, or their societies are no longer experiencing this crisis level, mortality, bearing in mind that to help reduce mortality levels, those governments can at the same time, impose reasonable public health, restrictions. So this raises at least, four, separate issues. So first of all, so far I've spoken of residents and not citizens. So according to, the fair priority model, as I understand it and as I subscribe to it, priority has to be given up to a point to residents, of the relevant political community, and not just to citizens. Now, that's a very live, issue. I would, in other words, include illegal, or as you might say in the US, undocumented, immigrants. And it's a live issue. For example, as recently as March 2021, the British authorities had to explicitly reassure immigrants who were present illegally in the United Kingdom that they could register with a medical practice and be vaccinated without risking expulsion. And I understand that it's a live debate, in the US, as well. I mean, some countries have said explicitly that they were not going to include, residents in who has all residents in who has access, to the vaccine, but only their citizens. So that's the first, a point that I want to make clear, about the framework. It's residents and not just, citizens. The next issue is what it is that I mean when I say, you can keep the vaccine doses that you've been able to procure until you are no longer experiencing a crisis level, of mortality. So the first point to note here is that the metric is mortality or death. It's not other harms, such as, long-term disability and so on and so forth. And that's because death is irreversible. It's the worst possible harm that people can experience. And so, my colleagues and I who are working on this, thought from the very beginning that given that we had to choose one metric, we had to choose, the most severe harm that we can experience, namely death. It's also important to note that, other harms accruing, from COVID are alleviated when non-crisis level mortality, is reached. So we use mortality as the metric, but also as a proxy, generally. I also mean mortality from COVID and from reduced access to healthcare as a result of the pandemic. And this is really crucial. So when we consider what is the right, ethically speaking, way of distributing vaccines globally, and when we think that the principle must include mortality as a metric, we don't simply mean people who die from COVID. We also mean people who die not from COVID, but, for example, from cancer, and where the reason why they die during the pandemic from cancer is because hospitals are so overwhelmed by COVID patients that they simply do not have capacity to treat other illnesses. We also need to think about what we mean by a crisis level or a non-crisis level of mortality. And here, it seems to me that the most fruitful way to think about it is to have in mind familiar public health threats. So a good comparator is the flu. So here the thought is this, at the point at which COVID-related mortality reaches the yearly mortality of a worse than average but not terrible year for the flu, well, that's the point at which you cannot hold on to vaccine doses. You have to distribute to other countries which are still experiencing crisis levels of mortality. The third important point is what counts as reasonable health restrictions. So remember, the model says you can keep vaccine doses up until the point at which you are no longer experiencing crisis level mortality. But bearing in mind that there are two ways of reducing mortality. Vaccines is one, public health restrictions is another. So long as you can continue to reduce mortality by taking reasonable health restrictions such as social distancing, imposing the wearing of masks, installing air filtration systems in public buildings, well, then at that point, you have to give away, your surplus, doses. So that's what, the framework says. And the rationale, for the framework is that it is a compromise between radical cosmopolitanism on the one hand and radical partiality for fellow residents, on the other hand. So the framework should go some way towards pleasing, as it were, those who believe that governments are morally obliged to show preference for their residents, because the framework says explicitly, you may keep doses, up until the point at which you are no longer experiencing crisis, mortality. But it should also appease the radical cosmopolitan, or at least cosmopolitans who are a bit less radical, because it says you cannot hoard. There is a point at which you are morally obliged to give spare doses of vaccines. So on that view, the United Kingdom, for example, would not be morally entitled to say, well, we know that there are still people who are dying of COVID in another country, and we know that this country is experiencing crisis levels of mortality, but we're not going to give them surplus doses because we want to live under no public health restrictions whatsoever. So the framework says, no, that's morally wrong. The sacrifice for every single one of us in the UK of having to socially distance, to wear the mask, in closed spaces, that sacrifice is not burdensome enough to justify allowing crisis mortality, levels in other countries. So that's roughly, how the framework works and why we think, my colleagues and I, what we think is justified. Now, in that interview, I don't speak on behalf of my colleagues with whom, have written a couple of papers about this. I speak on my own behalf. And on my own behalf, I just want to say this: I endorse, the framework. I think it's a good framework, but I have very strong, cosmopolitan, leanings. I am actually, tempted to endorse fairly radical, versions of cosmopolitanism. However, even a radical cosmopolitan must be realistic, and that takes us back to some of the moral considerations we need to think about when dealing with this topic. Even a radical cosmopolitan must accept that given the way the world is, by and large, the best institutions for delivering and administering vaccines to a given population will be, the national, authorities, of that country. So that's the first point. The second point is, the radical cosmopolitan, has to accept that, vaccine distribution or, equality of access to vaccine is only one, value. There are other competing, values. And one of these competing values is the need for, governments to be seen to have, legitimacy, in the eyes of their citizens and residents. And the framework allows for that. I mean, a government, that would say, oh, well, it doesn't matter. It shouldn't matter to us that, people in our country are dying, in excess of, normal levels of mortality. We're going to distribute, wherever in the world. That government would not be seen to have legitimacy, by its citizens. And that would have very, very detrimental consequences over time, for the effective delivery of public services. So whereas, others who work on this believe that the framework, the compromise that it reaches is the first best, principle, I tend to believe that it's the second best, principle, which, makes room, for disagreements, about the conditions under which, governments, are legitimate and so on and so forth. Does that answer your question?
Oh, definitely. Yeah, it gives me some more thoughts for more questions too. I want to talk a little bit about the concerns, but first, I'm just interested to hear. You say that you have a radical cosmopolitan view on this.
Yeah.
Maybe some of your colleagues don't. So, what would that mean if you alone were deciding this framework, for example? What would you be doing differently to fulfill this radical cosmopolitan view?
I'm not sure that the principle in its detailed articulation would be very different. The key difference has to do with the rationale for the principle. Some of my colleagues in general, I mean, in moral and political philosophy, both in academia and outside academia, believe that there is something which is profoundly morally meaningful, to the relationship of co-citizenship or of co-residency. Meaningful such that if I were, for example, standing in front of a burning building and had to choose between saving the life of a fellow French or fellow British, I've got dual nationality. So, fellow French or fellow British on the one hand, and, someone from Madagascar, on the other hand, or, Colombia, then I am on the views that I'm describing and which I reject. I'm morally allowed, to give priority, to the life of the fellow French or, fellow British over the life of, the person from Madagascar, Colombia. Indeed, on the stronger view, I'm morally obliged by dint of that relationship of co-citizenship or co-residency, to give, that life priority. I do not have that intuition. I never have had that intuition. I've always had the intuition. I cannot remember the time, since I became aware of thinking about those things. I don't remember a time where I haven't held the view that those lives I should regard as strictly equal. And so on that view, which is a radical cosmopolitan view, the relationship of co-citizenship or co-residency does not make a difference to life and death. There is an even more radical view, which says that it shouldn't make any difference even to the distribution of non-life-saving resources. That's even more radical. But with respect to life and death, it really shouldn't make a difference. So the disagreement lies in how one justifies the framework. So some of my colleagues will say, well, you have three broad positions on the table. I can imagine some people saying, well, the framework is in fact, morally speaking, the right balance between the demands of cosmopolitanism on the one hand and the demands of acceptable nationalism on the other hand. Others will say, well, it's not actually, morally speaking, the right thing to do. It's a compromise, solution. And it's a compromise in the sense that we have no choice but to defer, to the nationalist, intuition. And that tends to be the view I have there, right?
Okay, so moving on to some of the objections. You touched on them a little bit in one of your previous answers. I think a lot of them come down to my country was better prepared than others. I
Yeah.
made social and financial sacrifices to deal with this vaccine, to deal with this disease, and my country is in this state, this better state than your country because of this. I believe you said that you don't think that that's burdensome enough to justify not distributing the vaccine. But if someone were to push you on that, how would you respond to that?
So I think it's a very important objection. I mean, it comes in different guises, and it has to be dealt with. It has to be dealt with, properly. So the first thing I want to say is that, this is not, I think, an objection to the fair priority for residence, model, and that's because, the countries which are, in a position, or in such a position that they can buy lots of vaccines, are already at the head of the queue, and the framework says very clearly you can keep your doses until they reach non-crisis mortality levels. So the objection really has to be, well, even beyond that level, because of the financial sacrifices I've made, or my country has made, we are not under any obligation to help people from different countries. It's our wealth, it's through the proceeds of our taxes. So then, I have a few thoughts there. So when someone says, well, look, we are better prepared because we've made lots of efforts, we've contributed a lot. Well, we need to know what better prepared means. So it could mean, for example, that we have invested more in research and development, or we have a healthcare system, which is better able to cope with the pandemic. And the only reason, the argument goes, why our healthcare system is better able to cope is that, well, we've paid more taxes. And my response to that is to say, well, but these are global collaborative processes, right? So there is no pure British research and development in that field. In fact, if you look at the makeup, the nationality makeup of vaccine manufacturers, I mean, these are global enterprises. So but being better prepared in that sense doesn't overlap neatly with national borders. Relatedly, national healthcare systems, I mean, the British healthcare system is a very good example, have very often relied on immigration, from abroad. So, the NHS, which is the national healthcare system in the UK, has a substantial number of non-British citizens amongst its, workforce. That is costly, for other countries. It's the well-known, phenomenon, of the brain drain. And it seems to me that any argument to the effect that we are entitled to hold on to the vaccines, we can buy, by dint of the fact that we've paid a lot of taxes to help the NHS, any argument along those lines has to be sensitive, to the cost for other countries of our having, the healthcare system, that we have. I also worry a little bit about any argument that will say that wealth is decisive when it comes to, life and death allocations, of resources. I mean, I think, a lot of people, including people who are sympathetic to the objection you raise, would balk, at the idea that, as between, someone who needs a liver transplant, which will save his life and is wealthy enough to buy one, and someone who needs a liver transplant that will save his life but is too poor, to buy it, the liver should go, to the former. I mean, I think a lot of people, have the intuition that need, is the right basis for access to life-saving, medical resources, not ability to pay. And finally, I always want to know, where do the wealth come from? So in the United States, you have a long, standing debate about past injustices, and in particular reparations for slavery. In Britain and in France, the debate is partly about slavery, but it's also about colonialism. And here the argument is, well, if you look at the processes by which national wealth, has been accumulated, you are likely to find enormous amounts of, injustices, including injustices committed against, the descendants of, committed against the ancestors, of, populations nowadays, which are desperate, for vaccine, doses. So the thought here is, well, it's not clear that national wealth unquestionably belongs without restrictions, to the people who happen to have it.
I think I'd like to change the order a little bit, if that's okay, because I think this leads well into my question about the concern about high-income countries dictating this process. So,
yeah, do you mind if we talk about effectiveness? Because it's another important objection, which I was going to raise under moral considerations, but I didn't.
Effectiveness of the...
Well, so the argument here is, well, it's all very well to say, we are morally obliged to give doses to other countries, but what if they make a mess of, allocating,
Okay.
doses? Yeah, is that okay?
Yeah, I can ask that question as well.
Yeah, that'd be great. Thanks.
Okay. So these are, for me, very persuasive arguments about the need to distribute these vaccines globally. And I fully take your point that countries like the United States, the UK, other high-income countries have a moral obligation.
Right.
How do you respond to the argument that you might be giving these countries millions of doses of the vaccines, but they're not prepared to distribute them effectively? How do you respond to that issue?
So I think, again, that's a very important objection, and it's easy, to dismiss it as, well, it's not really a moral, objection. It's just a question of implementation. I think it's easy to dismiss it in those terms, but I think it's a mistake to dismiss it in those terms. It really is a profoundly important moral question, because if the vaccines, once they're distributed to countries in need of doses, are not distributed to the people who ought to have them, it's a waste. So we might as well have send them elsewhere, and we should never forget that it's a matter of life and death. So there are different ways of it seems to me responding to that objection. The first way looks at, okay, so on what basis do we make the judgment that a government will be ineffective at distributing vaccines? And not so much nowadays, but a few months ago, you would hear people say, well, they've made such a mess of dealing with the pandemic up until now that we cannot trust them to deal with the vaccine effectively. The United Kingdom is a very good counterexample to that argument. It did not deal in the first year of the pandemic with the pandemic very well, but I think it's unquestionably true that the vaccination campaign has been a major success. So the first response to that objection, looks to the evidence. What is the evidence for saying that this government will not be able to distribute the vaccine effectively? Now, a response to this will say, well, the governments in these countries, X, Y, Z, have a track record of extremely poor, management of aid in particular. So the effectiveness objection parallels debates in, the ethics of international development about aid conditionality. And here the response would be, well, even if it is true that, a given government, by the look of it, would distribute the vaccines very ineffectively, or indeed even very unfairly, the fact is that it's still likely that, the doses of vaccines that are delivered would save lives. So for us to say, well, no, we can't, give the vaccine, to them, might be tantamount to almost punishing, the population for the misdeeds, of the government. And the second response tries to be a bit more creative with institutions and to say, well, but if there is a way of bypassing governments, by distributing vaccines to, local NGOs and so on. Might this be a way, of getting around, the effectiveness objection? So the headline news, if you will, or the take-home point, for that particular problem, is, well, before we rush to judging that distributing to this particular country, will be ineffective, we have to be a bit more clear as to the evidence that we marshal, in support of that claim. And before we decide that the evidence is good enough, that we must desist from distributing, we have to think about alternative mechanisms for getting the doses where they ought to go.
This brings up another issue that I can think of. Not really an objection to the plan, but maybe just a different way to look at it. And that is that, countries like the United States are somewhat dictating this process because they're in possession of the vaccines, and we see the millions of vaccines that are being distributed. We've seen Biden's plan about that. And the concern is that this just reinforces global health inequities for the United States, the big Western nation, telling this country can have the vaccine, this country can't, this country we're going to give it to the NGOs. So how do you think about that? And does that concern you as you work through this process?
Yeah, it does. Of course it does. And I think it should concern anyone, who is committed to, if not full, because that's utopian, global health equality, at least to reducing global health inequalities. I mean, the solution, or one solution, which is a very imperfect one, lies, it seems to me, in the establishment and ongoing support for, over time, of robust international institutions with different voices around the table, not just the wealthiest countries in the world, with enforcement mechanisms. I mean, this is where some people might say, but that too is a very utopian line of thought. But I don't really see any other way, to be honest, at this point. I mean, the path to building such international institutions, as we know, from the UN, the International Criminal Court, and so on. So the path is long and rocky, but that alone is no reason not to start walking down it, as it were.
So I just want to go back and speak a little bit more about some of the how you've approached this over the past year and a half now, since we've been dealing with this pandemic. So when you started looking into this, was it useful for you to look at previous pandemics, previous vaccination campaigns? The two that come to mind for me are the 1918 flu epidemic, the polio vaccine campaigns in the I believe it was the 1950s. Did anything like that inform your work and change your thinking about this process?
So I think that's a very good question. I mean, in my case, not really. And there's a sense in which it's a sad admission to make. I mean, not really, because I've not worked on global health justice, and I think before now, and if I had, that I think would have been my default mode. Or let's look at previous cases. I mean, in addition, I always get a little bit worried, when we start thinking, what lessons can we learn, for example, from the 1918 flu pandemic, or the polio vaccine campaign, because the cases are so different, and I want to know what is the proper baseline for comparison. I mean, if you look at mortality, well, as things stand, the COVID-19 pandemic is dwarfed by the 1918-1919 flu pandemic. If you look at a pandemic that put a stop for a long time to social and economic life across the globe, well, I think this one is unique, as far as I can tell. So I haven't, by dint of my previous research, but also my distrust, wariness about these comparisons, I have not tended to think about it in the terms. What got me into this is the work I've done for years, although in different contexts, on cosmopolitanism. So that for me, was the hook, if you will, on which I hang my thinking, about global ethics for vaccine distribution, at least this particular vaccine.
So how did that work inform your thinking? You've written books, Cosmopolitan War, Cosmopolitan Peace. So how did thinking about war and peace and some of those issues inform your thinking about this?
So good. So the thread is cosmopolitanism, and when you think about war, in effect, by and large, you have to think about the ethics of killing and the ethics of saving lives. And here, the similarity between the two questions, is this. So in war, we have to decide whether the lives of our compatriots are more important, than the lives of enemy, civilians. The principle of non-combatant immunity, which prohibits deliberate targeting of enemy civilians, in effect says you may not deliberately kill enemy civilians in order to save the lives of, your compatriots. So at the heart of, the ethics of war, but particularly the principle of non-combatant immunity, which is a cornerstone of the ethics of war, there is a very strong, cosmopolitan, principle. And so it's not a huge step from there to think, okay, so that's interesting. So we have a life-saving resource, which is a vaccine. Does the cosmopolitan intuition that I find and defend in my work on war carry over, into this particular, issue? So that's one point of, connection between those different strands, of my research. Over the last year or so, I've begun to see other connections. So, some people, think that war is a state of emergency, par excellence, that you need different normative principles, to deal with states of emergency compared to the normative principles that you need in order to deal with ordinary life. And so, again, it's not a giant step to move from that view to the views that the pandemic, as we know it, is a state of emergency. It's a global crisis, and so we might need, completely different, principles. Now, as it happens, I don't believe that war is morally exceptional, that it's a state of moral emergency. I don't believe, therefore, that the principles that ought to regulate war are radically different, from the principles that ought to regulate ordinary violence. And I'm inclined to think that the same goes, with access to vaccines, during a pandemic, but I have to do more thinking, about that.
Final question. I want to look to the future a little bit, and so I've done a little bit of reading that scientists think that they're better prepared for the next pandemic because they've done so much work on this vaccine.
Yeah.
And they think that they could have, for a new coronavirus, they could have a vaccine ready to go. So I'm just wondering if that is the thinking with the fair priority for residence framework too, that this could be a template for, hopefully we won't have to deal with it for a very long time, but whenever the next pandemic emerges, something like this is in place to have the world get back on track a little quicker than it did.
So I would hope so. I would hope so, because, the concerns which the fair priority for residence framework tries to handle, i.e., how do we balance the needs of our fellow residents or citizens, with the needs of distant strangers, against a background of enormous inequalities, in wealth between different communities. I mean, those concerns are not going to go away, right? And in fact, those concerns are not unique, to the pandemic that we have been witnessing for the last year. I mean, a good deal of moral and political philosophy over the last 40 years has been concerned with precisely that question. And so, when we are hit by the next, pandemic, infectious disease, pandemic, such that only a vaccine together with public health, restrictions will, do, well, we're going to have to grapple with the same concerns, right? So I would hope that, modulo, whatever revisions are required by, changes in context, I would hope that the model could still be useful.
Professor Cécile Fabre, thank you so much.
Thank you very much. I really enjoyed that. Thank you.
That was Dr. Cécile Fabre, Professor of Political Philosophy at the University of Oxford. I'll be back in the coming weeks with the next episodes on the ethics of global vaccine distribution. For more, including a transcript of this talk, please go to carnegiecouncil.org. Thanks for listening, and stay safe and healthy.